Multifocal spectacles and lenses can be incredibly beneficial, but they often come with misconceptions. In this video, we'll debunk some common myths, show you the correct way to wear multifocal lenses, and discuss how long it typically takes to adjust to them. Watch to learn how to make the most of your multifocal lenses.
So the misconception, I would say there's two kinds, the bad misconceptions and the good misconceptions, but both are not so desirable. So the bad misconceptions are the usual. When you wear progressive lenses, you feel like you want to trip or you can easily trip and fall. When you look through the progressive lenses, you feel dizzy, visions are wavy, not clear. And it is also the misconception that it's hard to get used to it and difficult to get used to it. Now, the good misconceptions are a bit like an oversell, like people telling you that the vision is good, better than your current glasses, that kind of thing, which is not exactly true. For example, if you were to compare, if the person has been wearing a reading glass before and to compare a reading glass vision from just a reading glass to a progressive, the reading glass vision will be easier to use. Now, clarity might be the same, but reading glass will be easier to use. However, progressive is still essential in some ways because if someone wants to see far and near at the same time, they need to do progressive lenses. Before we talk about this, we have to make sure the customer understands that there is a period of adaptation when wearing progressive lenses. They have to understand that progressive lenses are three lenses blended into one. There's three visual fields: the distance, the intermediate, and the near. Wearing progressive lenses for the first time, there might cause a bit of what we call soft dizziness. This is because the brain is adjusting to the new type of lenses. This soft dizziness normally will go away in 1 or 2 days. But most importantly, for progressive lenses, patients have to keep on wearing it. The longer they wear, they will adjust to it better. Now, secondly, take note is that you need to make your progressive lenses at the licensed practitioner because it is important that the progressive is set properly. The center of the eye or the focal point is taken down properly so that when you look through the progressive, you are looking through at the correct points. So adjustments of the frame have to be done before they take this point, and also when you collect your glasses when it's done so that it is sitting properly. Now for wearing the progressive itself. First of all, we must tell the patient that they have to understand this three field of view. What they need to do is, so ask them to look straight. So when they look straight, ask them to look far. The far vision should be clear. And then ask them to look at somewhere intermediate, maybe some on the table in front of you. Looking like just moving down your eye, the vision should be also clear. You should be able to see the intermediate vision. As for reading, ask them just to look down, like your phone, hold it like this. They should be able to see the reading material on the phone, whether looking at the WhatsApp or SMS. Now, when the customer understand these three field of vision, then it's about how to wear them. So basically, when looking left to right, have to educate the customer when want to look to the right, they have to turn their head to the right. Basically, use your nose as a pointer. So looking at the right, point your nose to the right, and when looking to the left, point your nose to the left. And it's the same thing when you look far and down. So far and down are things like, for example, if the customer is driving and wants to see the car number plate in front. So if he's using a progressive lenses, he has to tilt his head down a bit so that he can read the car plate number easier. Instead of just moving the eye down, or when looking left and right, just moving the eye to the left, to the right. Because progressive lenses is a three vision blended into one, there are some points of the lenses that are a bit more distorted. So if you were to look through the corners, you will not be as clear as turning your head. So doing this and practicing wearing, like wearing it all the time, every day, all this movement will become natural. So you will not need to think about it. Your brain or you yourself will automatically turn when you want to look right or want to look left. It will automatically be second nature to you. So usually it will take about 1 to 2 days to get used to multifocal lenses. But there are instances where people immediately, like a few hours or 1-2 hours, get used to it. And there are cases also where some people might take a week to get used to it. So it varies, depending on the person. However, as I must emphasize, wearing the progressive daily and persistently will make you adapt to it faster. And people who are thinking of doing progressive lenses, especially people who have a higher degree, like -400 and above, normally in my experience, they are easier to adapt. They adapt to progressive faster.
To get the most out of your multifocal lenses, follow your optometrist's instructions on proper use and care. Gradually increase wear time to help your eyes adjust, and ensure your lenses are kept clean to prevent infections. Regular checkups can help monitor your adaptation and make necessary adjustments. Thanks for watching. If you enjoyed this content, please comment, like, and share. Let's build a healthful community together.